This is Dr. Ben Pearl. So today we're following up a venous leg ulcer, and first we're going to get a measure, and we're going to use a new product. It's a spiral type of Kerecis, and the name of it is Shield. So let's get our measurement first. This is looking to be about 2 by, let's do the cross, and I've got my trusty assistant here, 1.7. We're going to do some light crosshatch. You can get out of the field there, thank you. Light crosshatch. We've got a pretty good base. And I'm going to say that the depth now, Marcus, let's get a depth measurement here. I'm going to use it with the tip of the blade, sir. Come back in the field, and let's just get a tip of the blade, just so we have a depth measurement. And I do this as my dipstick, and that's looking to me to be about 3 millimeters. So somewhere between 2.5 and 3 millimeters at its depth. Notice it's bleeding a little bit now. We're just getting all those good capillaries to receive this novel wound. Now that's getting a little bit, so we don't want it too much seroma. Now, we're at the point of where we're going to get the acceptance here. So what we want to do first, we want to lay down our inner strut. So we want to do that. And I'm going to try to lift this up and not stick to the graft. So we're going to use these 2 outer rings. And we're going to snip those babies off, and that's going to be sort of the struts or the foundation for the graft. So I'm going to put this inside. I'm going to try to tighten this up. Now you can cut this or whatever you need to do.
He's got it. Yep.
Yeah. And what I'm going to do is I just don't want this to coil out too much. So what I might do, if it
maybe give it another cut.
Yeah, I might do. Yeah, and I might just cut the thickest part of the cut because that's the strongest strut, just so it can manipulate a little bit better. There, I think we're curling up a little bit better now. And sometimes difficult to do with gloves. Now we got sort of our hub, if you will. And I just want to make sure we're in the inner sanctum of this wound. And I'm going to incorporate there. You okay? Mm-hmm. Okay, just going to do one more little final check to make sure that it's not going to be on the outside. I'd rather have this strut on the inside. Okay, all right. All right, so we're going to let this collect a little bit just so it's not quite so springy. And then we're going to seal and do the final bit. We're going to use the shield side and put the circle right over the centric part of the wound. And then just like that, and the only tricky part is we got to get our little end here it folded. Devil's always in the details. Now what you could do, and what we may indeed do, is just on this one edge, if I'm not able to lengthen this, because it's a very thin layer here.
On the right side is kind of open there. If you get it, yeah.
This guy here?
Like a little under. Like if you get a little under, flap it a little bit, then you can get it. It's right there. Like.
Yep. Yeah, it's in 3 dimensions here, so yep.
Right
I think we got it. And at least enough of a margin. All right, and now I'm going to try to see how we get on a bond, and that's pretty good. Mm-hmm. Yep. All right, so finalizing. I am going to let our product specialists let us know about how long we want to lay this. So voiceover.
Sure. This product will incorporate in 7 to 10 days. Okay. We want to leave that silicone lovely layer that we will remove dressings 3 days, every 3 to 5 days to let that wick out. But this silicone layer is your protective layer. Nothing gets removed underneath that, okay? So in 7 to 10 days, this product will adhere to the body, incorporate with the body, and actually strengthen that tissue that we're regranulizing. And then we're gonna go ahead and see where it is next week and maybe reapply.
Yeah, and if it's smaller, we might use a smaller graft. So we'll
100%.
assess it at
100%.
Okay, so we've got a good bond here. She knows the details. You're not to get this interrupted. The recommendation then would probably be bathing privileges. Do you have a shower bag?
Keep it dry as possible.
Keep it dry. And we have shower bags if you want to purchase one. Otherwise, we'll have to do sort of the Euro bath. Do not take a chance that you're going to be able to shower with a bread bag. It will get wet invariably. Till next time, until next week, this is Dr. Ben Pearl with FitFoot U.